There we go. Recording in progress. So hello and welcome to tonight's Q&A. Thank you very much, Kim, for joining us and coming to talk to us a little bit about what you do and what you've been up to. And yeah, so we'll hand over to you just to give yourself a little bit of an introduction.
Sure. Thank you. Hi, everybody. My name is Kim Vopni, and my brand or handle is Vagina Coach. I guess I'll give you kind of a quick intro into how I got into doing this and where I am now. So back to 6th grade, I saw a childbirth video. It put the fear of God in me, and I thought, no way, I'm never going to have babies. And that was sort of my growing up existence. But I remember asking my mom questions. My mom was an operating room nurse. She was very open with anatomy with my brother and I, which at the time was very cringy, but now I feel grateful the fact that she used proper anatomical terms and allowed us to ask questions all the time. Anyway, I asked her about hers. She was open and she had episiotomies. She had incontinence. She had surgery for her incontinence. She had chronic back pain. She had, I didn't know diastasis at the time, but she had a tummy that wouldn't flatten no matter what she did. She gave up running. She gave all these things up because of the challenges she was having. And so the picture that was painted for me about childbirth and you know, being a woman wanting to be active was that childbirth kind of did a number on your body, and you would eventually have to let everything go, and you're probably going to need to have a surgery down the road. So I thought, okay, well, I won't have babies. And that was until I decided I did want to start a family with my husband. Then I was like, okay, I'll just have a cesarean section and then I'll be fine. And my pelvic floor will be perfect. And started to do a little bit of research and recognize that that's really not the case. I did end up having 2 vaginal births. I used a biofeedback device called the Epino, which I do know, I'm not sure where all of you are from, but being in the UK, it is something that is still available in the UK and all throughout Europe and Australia. It was available in Canada up until the end of 2018. And so I used that product, had a great experience, asked to become a distributor. It was meant to be a side little thing. And that's what essentially brought me into the world of pelvic health and doing what I do now. So it started out with the Epino. I had pelvic floor physical therapists referring to me. I had never heard of pelvic floor physical therapy. So that was my introduction to that profession. Now this is back, I started selling the Epino. My first son was born in 2004. So that's when kind of the process or the things were starting. It was a little side thing. Used it again with my second son, had another
feedback device then.
It's a biofeedback device. Yes. So it is, it looks like it's a silicone balloon that's attached to what looks like a blood pressure gauge. And when you contract and relax, there's a little bit of air in the balloon. When you contract and relax, it shows on the gauge. You also use it for perineal massage. And what I look at it as is a way to introduce sensations of stretch and pressure and discomfort to try to help you inform your body of sensations of discomfort that you need to learn how to yield to, how to surrender to. So it's trying to, as close as it can, mimic vaginal childbirth, obviously to a much lesser degree. But I found it incredibly valuable. And anyway, so I was the distributor for 14 years, introduced me to pelvic health physical therapists. I started screaming from the rooftops about that. And then my little side thing turned into more full-time in 2009. So that's kind of when I started my business, I had then an e-commerce store with pelvic health products. I was focusing at the time mainly with pregnant women. And I created my first program was called Prepare to Push, it still is a program. I also wrote a book called Prepare to Push. And that was really to try to introduce pelvic health to people in pregnancy with the aim of seeing that as a time where we have a missed opportunity for talking about the pelvic floor and how could we step in and try to mitigate some of the injuries and challenges that people have afterwards. So did that for a while. Then I started to learn about diastasis. And so I was and there wasn't really a lot of conversation or research or people talking about it. I did find one woman in the United States by the name of Julie Tupler. So she was kind of one of the, I would say, pioneers with regards to diastasis. I would say she has not necessarily kept up with the research as much as others have now, but she was definitely one of the very first people talking about it. So I took her course, came back to Canada, was going to bring it to Canada, met another woman who was talking about pelvic floor stuff. And I was living in Toronto at the time. And we were going to bring her program to Canada. And then we started selling her wrap and using her exercise protocol. And then we had a physiotherapist referring to us, a pelvic health physio. We finally tracked her down, and the three of us sat down and said, you know, we like this, but this is what I would change, or this is what I would do differently. So we ended up forming our own business called Bellies Inc. And we created a postpartum recovery wrap for the first kind of 6 to 8 weeks postpartum, with the intention of looking at other cultures around the world that use belly wrapping and belly binding, but making it a bit more mainstream, modern, with incorporating it with movement, making it less restrictive, facilitating movement. So we did that. So I was juggling the two for a number of years. But I think it was about 2010-ish. So around the time that we're starting with Bellies Inc., I was always randomly searching for things on the internet. And I found this woman named Kaisa Tuominen, and she was doing this weird technique that I was going, what the hell is she doing? And she was talking about prolapse, and most of her stuff was in Spanish. It wasn't a lot in English. Anyway, I reached out to her and said, you know, I'm curious, fascinated. What are you doing? And would you come? So we developed a relationship. And then the intention was she was going to come to Canada to teach.
Yeah.
And she got pregnant. And so that put a little bit of a delay on it. Long story short, Trista Zinn, who's, I'm assuming most of you probably know who Trista is.
Yeah, I trained on the same course as her.
Okay. So Trista and I have known each other since we were 15. And I was teaching in my journey, I was teaching with Dr. Bruce Crawford, who's the founder of Pilates. Yeah. And I invited Trista to come to the Pilates course that I was teaching in Toronto. And that was Trista's introduction to pelvic health. And after that, she was saying, you know, I have this hip pain and I have this. And I said, go see Julia, who was my pelvic floor physiotherapy partner from Bellies Inc. I said, go see Julia. So she did. And that's when she found out she had a prolapse. And so if you know Trista, you know her story. So that was kind of the introduction. That's when she found out she had a prolapse. And I remember her phoning me on Mother's Day weekend, just beside herself, because she was alone. She got this diagnosis. And Trista is, I always joke that fitness is almost more important than her children to her. Like fitness is her life. And
yeah, I get that.
Yeah. And it was just like, she was so devastated. And, you know, she was like, should I do the Pilates exercises? Should I do this? And I said, you know what? I try this. Like, I've been watching this woman. I'm hoping to bring her to Canada, and so Trista went and started watching these YouTube videos, and then eventually flew over and obviously did the same course as you. So, you know her story from there. So, anyway, that was my introduction. That's how I was introduced to Hypopressives. And then Kaisa did end up coming to Toronto, and Trista was, you know, helping organize that first course in Canada. So that was, I think it was 2011 or 12. I can't remember exactly when it was. And yeah, so anyway, that's kind of how I got introduced to Hypopressives. And then since then, Bellies Inc. grew, sold that. I do certification courses. I have online programs for women. I have an app. I've written a couple of books. I speak, and I will tell anybody who will listen to me about pelvic health. And my general philosophy and belief is that I think most people benefit from a combination of hypopressives and pelvic floor like Kegel type exercise coordinated into a movement practice.
Absolutely. Yeah.
Yeah. That's me.
I just think from kind of what you're saying that you're quite forward thinking in terms of the UK. So we in the UK, I think that if anybody here can truly say that they found out about their body and did all the most people that I find, and that I'll count myself into this, is that I didn't really look for anything until I had a problem. And that is the problem, isn't it? Is that you just said, I wrote it down, missed opportunity. It's a missed opportunity in this country to educate people before they even think about childbirth, about their body properly, you know, about sex education, not the way it's taught in our schools.
Totally.
And about like what is going to happen to them during their pregnancy and how their body is going to change, and if they have a cesarean section, what that means for them. if they have a vaginal birth, what that means for them. I just think that we are very much, I don't know whether it's the same way you are, but you seem a lot more kind of forward thinking than a lot of women that I see, in that we don't really, it's like I've suddenly got a prolapse, I've suddenly got incontinence.
Yeah, no, it's the same here. It's like, it really is. It's what and I learned this really through my Prepare to Push and through Bellies Inc. is that people are much more motivated to fix a problem that exists than they are to prevent something from happening in the first place. So it was, our biggest customers in Bellies Inc. were second-time moms. Trying to sell to the first-time mom was like, oh no, I'm fine. I do yoga. I do this, I do that, which is great. But they were also then the ones going, we have so many quotes of people, I really wish that I'd paid attention. I really wish that I'd taken this course. I wish that I did. So no, I wouldn't say that the UK is really that much different. It's the same here. It's changing a little. Like, social media has definitely created a lot more awareness. And so there's more people who understand, but I would still say that it's more common for people to want to rectify something than they are motivated to fix, to prevent something from happening.
Yeah, 100%. I mean, wouldn't it be so much, I mean, it would take the burden off of our health systems. It would take the burden off of women themselves if they knew about all these things that could potentially happen to them. And I don't really know what that's about, whether it's just that people are a bit scared to find out about,
well, that was a very much when I first started out. Things again are different now, but when I first started out, there was a bit of backlash from the birth community. Midwives and doulas were not in favor of what I was doing because they thought I was creating fear, instilling fear in people. And my comment back to them was, I wasn't saying, you're going to have a prolapse, you're going to tear, I was presenting it in a way that this is the body, this is how it works. Here's the way pregnancy and birth influence it. Here's what you can do to mitigate this from happening. But I said to them, what's actually more fearful for that person is when they have something bulging out their vagina after, and they have no idea what it is, and they think they have cancer, or they think, and then the resentment that person feels because nobody told them. And so there's more buy-in from the birth community now, given that there's been a voice given to the devastation of a prolapse diagnosis. And prolapse, I would say, is the one that is the most devastating compared to incontinence and incontinence really. But yeah, so the world is changing slowly but surely.
Yeah, and don't you think that actually a real positive to come out of the whole situation that we've just been through with COVID and lockdowns, and it was the fact that forced everybody, whether they were doing online stuff or not, to go online and shout from their online platform.
Yeah.
So therefore that has meant that there's a much bigger awareness around women's health, around women's health issues, and around hypopressives.
Yeah. And it's also created a space where people feel more comfortable accessing, because telehealth has happened now. So people recognize that, oh, we can do health online. And excuse me, the barrier for some people could be geographic, it could be financial, it could also be shame and embarrassment. So going in and sitting in front of somebody and talking about these issues or having them evaluated could be difficult. So being able to go online with somebody in a safe place in their own home with nobody else around. Yes, they still need to disclose to another person, but it takes a little bit of that barrier away for a lot of people. And so I think that I think that that's been a positive for sure.
Yeah, because often you find that women will get together in a group, have a few drinks, and that's when they start telling their darkest secrets almost. But yeah, you're right in that, if they don't have to go and make an appointment and go and sit in front of someone and talk about things that are really quite personal, there's definitely like a real taboo about talking, well, there has been in the past, about talking about anything like this, which is why it's kind of quite refreshing to have a conversation with you, because I often have people that confide things in me, and you know, they're like, oh, I'm so sorry, I'm telling you all this graphic detail, I've only just met you. And I'm like, no, please, I hear about these things every single day, and it's, you know, it's good that you're kind of coming out and feeling like you can talk about things that really have a major effect on people's bodies. I mean, like you said, with something like a prolapse, can go undiagnosed, really. With someone, if you think about Trista's story, where she says, you know, all she had was a little bit of kind of glute piriformis pain that she didn't really understand. She was exercising a lot, and, you know, totally devastated by the fact that she was diagnosed with a prolapse. So
and I think so two things. I'm going to forget one point that I was going to make there, but the one with Trista, I think hers was also heightened because she had just been on the course and she had sort of seen worst case scenarios, and so in her mind, all she had was this visual of like a 4th degree prolapse, but there's also the people who, you know, Google is a scary place. So they receive that diagnosis, and what do? They go to Google and they look, and now hopefully it's some social media people and are showing up in those searches, but a lot of time they'll find images that are really disturbing, and it's challenging. And I forget the second point I was going to make, but it'll come back to me in a second.
Don't worry, I'm frantically scribbling notes from things that I'm remembering to ask you. When you're talking. You're right with images. I mean, I remember we did a hypopressive course with Kaiser when she came to the UK, and it was literally the first course that came to the UK. And I remember that something that we very much changed in our courses was the slide after slide after slide of prolapses. Right. And I think that you do need to know what it's about, but you don't need to know. I mean, certainly from my perspective, I'm not a medical professional, I'm a health and fitness coach, so I don't need to know, and I don't need to see many prolapses, and so it is quite shocking. And I think that definitely on that course there was that shock value to it, which really made me sit up and think, I need to go and find out a little bit more about what this is and why it would affect someone. Because, you know, my story is I had my own issues, and I was a bit like most people that I see, in that I didn't really think about doing anything until I had an issue, and mine was incontinence. And you know, it's not very nice in itself, but it's not one of the worst things that can affect someone, is it?
Right. That's the one that's, you know, it's just like, well, I'm fine, I can just put a pad in. So that one's a little bit easier to kind of brush aside for a little bit. I remember the point that I was going to make based on what you said, so thank you. The other thing that I think was an important part of my journey too was at the beginning so we formed Bellies Inc. And then we ended up creating a certification course, because we recognized that in health and fitness, when you do a personal training certification, there's zero information about the pelvic floor. And when you consider the statistics, and that statistically it's mainly women who are working with personal trainers, this needed to be shared. And at the beginning, we were, I mean, at the time, we really didn't have a lot of, like, we had a few little issues that we had, but we actually didn't share our personal stories. And then later on, when we started to say, you know what, I did have a prolapse, or I do have a prolapse, or I had incontinence, or it actually, because at first we were kind of like, you know, we have to be the ones who have overcome this, or we haven't even experienced it. We've done all the right things, because then people are going to want to do what you're doing. But it was the vulnerability of sharing your story that made you much more relatable. And then it actually helped people. Then we're like, oh, so you do exercise when you have a prolapse? Oh, you still do this? You still do that? Because there's a lot of fear around, if I do this, then that means I can't do anything. And you're often told, you can't lift weight, you can't run, you can't this and that. And so us sharing our stories and sharing our movement and sharing what we were doing, I think also helped paint a different picture than what a lot of people would hear from their care providers.
Yeah, you're very right in that the personal training qualifications, even now, are very, very lacking. Yeah. It's almost like a skeleton for what you need a skeleton to start you off, and then you just need to go and kind of add your specialism. So if your specialism is pre and postnatal, or is women in general, but I think that's really bad. I think that should actually be something that's built into the qualification by the training provider. And even if they're getting outside people like yourself or myself to come and do that side of what we know, then that should be a thing that they set the standard for. Because as you say, I mean, I go to a gym and I keep myself to myself because I'm not working. I'm doing my workout for myself. And I see personal trainers with women who I know from my own experience will be experiencing issues with the exercises they're being given without really any consideration for. And it's almost like it's a bit of a joke. Oh yeah, you know, I do leak. I just wear a pad, or, you know, if I do that class and I jump too high, or I do a certain exercise, then I'm going to have an issue with it. But it's about actually stopping that from happening. It really makes me quite cross to think that I'm in that profession and that not so many personal trainers really think about that side of it. What is your experience with that? Because you've obviously run courses, and do you find you get a lot of buy-in from personal trainers, or do you find it's mainly kind of physios and
most of the people that have taken the course, we've had a handful of chiropractors, massage therapists, non-pelvic floor physio. So we actually had, or still have, an internal course specifically for pelvic floor physios that was meant to, because when they do their pelvic floor internal training and to become a pelvic floor physical therapist, everything's on the treatment table, and it's very much, assessment, diagnosis, manual therapy type things. But we were really focused on the movement. So how do you evaluate in standing? How do you evaluate in movement with your practitioner? So that was the course that we had created at the time, and it still does exist right now. But non-pelvic floor physios would be coming to the certification course as well. And but the majority were personal trainers who came, and still, I would say that still is the case. Interestingly, so we've been teaching since 2013, and I can count on two hands the number of times a male has been in our course. Yeah. And there's a lot of male personal trainers who work with women, and that's like, it hasn't even been 10. I think I can count. I think it's been 7 or 8 that have actually physically taken the course, even online. So that needs to change. And again, I think it needs to go back to the basics of, if you are getting certified as a personal trainer, the pelvis, the pelvic floor, male and female, needs to be addressed and discussed and identified. And we need to learn the anatomy and the function. And this goes back to teaching education to consumers, to kids. And I know the NHS has proposed that pelvic health education is talked about in schools, which I totally agree with. Introduce the fact that the female pelvis, why it's different than the male pelvic floor, what are the similarities, what are the differences, but what are all the additional influences on the female pelvis that we need to be aware of? Menstruation, hormones, insert of sex, pregnancy, childbirth, menopause, like all of these things that the male anatomy just simply does not experience. And so it needs to be addressed. And I actually am teaching a course at the end of May, and I think there's 3 males signed up for it right now, which great, shocking that
we always say that we have a token man on our courses, and that isn't always the case. It's majority of people that come on the course are women. I would say that the majority of the women have come on the course because they have a problem that
1,000%
treatment that hasn't helped with.
Yep, exactly.
And that's certainly true myself. That's kind of why I looked outside of conventional treatment, because I just didn't really find that I got enough from pelvic floor squeezes. In fact, I didn't really feel I got anything too much from pelvic floor squeezes on their own. Yeah. So that's why I was out there searching for something different.
Yeah, that's very much the same with us, that the people who are there they work with women. However, they also have experienced or are experiencing an issue themselves, and they're looking. So it's the same thing, that now they're like, oh, I don't really need to know. I'm fine. My clients are fine. Like, oh, now I have the problem. Okay, now I'm going to pay attention. So it's the same thing, right? They'll pay more attention when they have something, when it's personal. I guess is what I'll say.
And I think that's the case with men, is that when they maybe have a partner who's had a child, that then has the issues, they start to think, well, hang on, I'm training these women, and I'm maybe not serving them particularly well.
Right.
Yeah. So yeah, we're very much the same with our courses, is that we find men it doesn't seem to appeal to them, and yet it's so very important. I mean, that something has to change within that training spectrum, really, doesn't it? It has to change in that they have to bring in more in-depth training, not just how to program someone to lift weights, which is basically what you learn on a personal training qualification.
It's so who knows how that so CanFit Pro is the kind of the certifying body here in Canada for fitness professionals, and they created a course, it's specific to pregnancy, where they had me come in as a guest and create a module specific to the pelvic floor. So I still am trying to push them that the basic personal training certification that you offer needs to have this as a module within there. And then that can lead to, so it doesn't need to be like the full 2-day thing that I offer, but the conversation needs to be addressed and why they need to pay attention. And at least the seed has been planted for them to then at least have, in their screening or looking out or saying, this is maybe what my client's dealing with. And then from there, they can choose to go and take more in-depth education, but at least let's get the seed planted.
Yeah, absolutely. It's a difficult one though, isn't it? I mean, I don't know what you find the uptake of, like, generally health professionals, especially like GPs, and I mean, it's starting to change here, but I think it's going to be a long route, in that because there isn't that kind of white paper research behind hypopressives in particular, that you're kind of almost, before you've even opened your mouth, they hear the word hypopressives, they realize there is some research, but there's not like that real standout research. And they just don't want to, they want to dismiss it.
Yeah. And that's the same here. And what I find, there's actually an interesting shift that's happening in the medical community because of COVID as well. There's a lot of medical professionals that are realizing how broken the medical system is. So I'm speaking specific to Canada here. A lot of family doctors are closing their practices. They're going into a completely different type of medicine. And so along those lines is because, yes, they have been part of the profession that has needed umpteen amounts of research that only is going to, to support their income by promoting drugs and surgeries and that type of thing. And even with the Epinode, I tried to go and introduce it to physicians as well, but because there wasn't oodles and oodles, like 50 years of research, well, then there's 50 years of missed opportunities again, where if this is something that can play a role in potentially helping somebody, then why not give it a try? Like, what's the risk of, I think there's a greater risk of not than there is of. So I think it is absolutely still a battle here. However, what has happened over COVID, again, there's been a shift. A lot of people have looked at complementary, alternative, whatever type of you want to give the name to non-medical professionals, and are recognizing that the medical profession, allopathic medicine, when we need drugs and surgery, that is who we want. Those are the people we want. But in terms of wellness and health and promotion and overcoming things like prolapse and incontinence, drugs and surgery, it might be an option for some people, but look at all these other things that we have to try first, at least to pursue. So I'm hoping that because of this shift that's happening, and the more people that are aware, that have even for the first time been introduced to other things other than a medical doctor, that people will now they're going to be a more informed population that will then even be looking for other solutions and not just saying, well, I'll just go ask my doctor. And then kind of being
that whole approach, isn't it? It's looking at kind of, rather than just one fix. And that's the sad thing, is that for the majority of women that I see, and I mean, there are some really good routes that some women have gone through, but for most women that I see, they just have been failed. It's
Yeah.
like there's this big bit that's missing. You know, they've gone to their GP sent them maybe to a women's health physio. The women's health physio is under stress, has nice guidelines to stick to, and doesn't really do the client the service that she really should. And so they end up being given something that they're not really sure whether they're doing them right. They're not really sure how long they should be doing them for, whether they're effective. And then a lot of the time people just give up.
Yeah.
And then, you know, things start to get worse. They might go through the menopause. They start to get worse. They go back to their GP and they get on a list for surgery. And it's just like, you know, there was that whole bit there that we missed out where.
Well, and what I have found, so since I've had a pelvic surgery, for those of you that don't know, I had a rectocele surgery about a little over a year and a half ago. And the experience I had in that process was, first of all, I was afraid to tell anybody. I thought, this is going to ruin my business. How can I do this? I've been coaching people to not go to surgery, and now I'm going to go do it. Excuse me, my voice is weird.
Right.
Now, you know, must mean that my stuff isn't working. So I experienced all that emotion and the shame. And in the end, I said, no, this has to be an option that is okay for people to choose. Yeah. However, you need to pursue or go into surgery with a level of education and information and preparedness about how to get ready for it, how to recover. So to your point, how many people I hear who, you know, finally they go get help. They go to their doctor. The doctor refers them to a specialist. The specialist recommends surgery. They have surgery. Their symptoms are gone. For the most part, most people's symptoms are gone periodically. But then they have another issue that comes up, or now they have a different prolapse, or it didn't totally fix my problem. And so again, another missed opportunity that we have where the doctors are fixing the anatomy, so to speak, which can be life-changing for many, can remove symptoms for many, but they then now are like, okay, well, I don't need pelvic floor exercise anymore because my pelvic floor is fixed.
Bye.
And so the people who have not been informed about prehab, who have not been informed about retraining the pelvic floor, who have not been told how to return to fitness, who have not addressed root causes like constipation, or, you know, things that could have been contributing factors to what they were struggling with in the first place.
Yeah, no, absolutely.
You know, we just, it needs to be so much more collaborative. So we have some work to do. However, back from when I started and selling the Epino in 2004, the conversation has definitely increased. The awareness has definitely increased. And I just hope that trajectory continues like it has.
Yeah, absolutely. I mean, it needs to, because, you know, the fail rate of surgery, and it must be, you know, the mesh surgery scandal that we've had over here, and now it's kind of suspended. It's just been dreadful for thousands and thousands of women that have been through it, and then, like you say, end up with something completely different wrong with them that is really quite debilitating. You know, I've the first person I ever got contact with that had mesh surgery was disabled after the surgery. Like, when she woke up, she lost use of her left leg, and so she was in a wheelchair and fought like you wouldn't believe to try and have a removal. And at that point they didn't do a removal in the UK, so she had to fundraise to get herself to America to get it taken out. Yeah, I mean, you know, there's that, like you say, there's that whole missed opportunity of, what about trying something that really, if it doesn't work, well, what have you lost? I think that's the whole thing. It's exactly, like, people say to me, you know, will hypopressives help with this? Will hypopressives help with that? Well, you know, give it a whirl. You just
totally
don't know. And for the majority, they get such positive benefits from it. Whether it means that they're completely cured, which they probably won't be, because there's going to be a general weakness there anyway, but just to have some relief of symptoms and to be able to kind of get on with life again is an amazing thing. So.
The other thing on that note that I find, and this is another part that I struggle with stressing to people, is the consistency. And this is like a life lifestyle that we are promoting. It is not, hypopressives will fix your prolapse and now you are back to what you were and you never do it again.
Yeah.
You know, the people who experience some relief from their symptoms, and, you know, I have this 28-day challenge, and so many people come back after a year or two because they're like, oh, you said consistency, you said this, but I just didn't pay attention, or I didn't do this. And so the trying to promote that this is like we brush our teeth every day. This is like we feed our body every day. This is a piece of your day to help maintain, to help prevent, to help, you know, it kind of comes back to that prevention thing, right? So once the symptoms are gone, symptoms are they're really good reminders to go do your pelvic floor exercise. And when we don't have the symptoms anymore, the reminders go away. So if you haven't built in the strategies and the lifestyle practices that, you know, that have you paying attention to pelvic health every day, then you can kind of end up back where you started.
Absolutely. Yeah. Shall we see whether anybody has a question? I know everybody's been intently listening. What does Liz say? Liz says, interesting point about male trainers. After prostate treatment, men are encouraged to do pelvic floor exercises. Yeah. So yeah, men have pelvic floors too. And we know that there are incontinence issues for men because there are incontinence products for men.
Yep.
So yeah. I mean, just generally that really, the whole going back to personal training and the qualification, and just, you know, I've been at it now since, well, it must be over 10 years that I've been a personal trainer. And really, from what I can see, the standard of training hasn't really changed an awful lot. You're not really encouraged to do any more than their pre and postnatal module, when it's so much more than that.
Yeah. Well, and I even remember back, so I first became a personal trainer in 1996, which is a really long time ago. And I remember this one man that I had as a client. I trained, I didn't specialize at that point. I just kind of did everything. And one of my clients was he was like late 40s. He was a pharmacist. He was overweight. He just needed somebody to help him move, basically. And we would always, you know, joke and laugh. And at the time, you know, the ab exercises were crunches or planks, and that's kind of what you did for your core, right? And I remember I would have him do crunches, and he farted every single time, you know. And when I look back on that now, why I didn't question, like, why does he fart every time? Not everybody farts when they do. What's happening, you know? So now it's like, of course, but at the time you just have no tools or even concept as to why that might be happening and what you could maybe change or to do differently. Right. So it's been interesting, but no, the course I took then versus the course when I got recertified. So I left fitness for a period of, I think it was like 5 or 6 years, and got back into it. And then the course that I took at the same time was the same thing. Same thing.
100%. So it just doesn't really change.
Yeah.
So let's see whether anybody has a question. So all my lovely audience, has anybody got anything that they would like to ask Kim? Otherwise we'll just chat between ourselves. Oh, here we go. Caroline says, do you use the hypopressives functionally, i.e. adding them in with exercise? Be interesting to see what you say about that, and then I'll give you my take on it as well.
Yeah. So here's what I do. This is my general practice for pelvic health. So every morning after a bowel movement, before I eat, I will do a 20 to 25 minute hypopressive practice. I am not very creative. I have my favorite moves, and I just eliminate the need to be deciding, because I have enough things that I need to decide and create every day from a fitness perspective. So I do the exact same thing every single day. And I love it. And I love that I don't have to think, and I just zone out, and I just am in the moment of feeling. I love feeling an apnea. I absolutely love, and it's the only practice I have been consistent with ever. So that's what I do for that. And then at the end, then I'll do, after I finish on my back, and then I'll do a few different, just like pelvic floor, basically kegels lying on my back, just to kind of, hello, pelvic floor. I do that maybe for like 30 seconds to a minute. Then I will go and usually have some breakfast, what have you. And then I'll do a workout of some sort after breakfast, which usually is some sort of resistance training, maybe a little bit of cardio, maybe something. And I incorporate my pelvic floor into not every single movement, but into some of them. So it just depends on the movement and how much weight I'm lifting or what have you. So that's kind of my functional training. I don't do a pelvic floor activation, like a voluntary pelvic floor activation as part of my hypopressive practice. On occasion, and it's usually mainly just if I want to make a creative video, I will use a band, like a TheraBand with my hypopressives, or use some sort of a, like the fitness circle, or use the wall or something like that. But generally on my own practice, I don't do anything fancy. I just keep it simple, what I love to do. So I don't need to think about it. And that's what I do. And then the rest is diet and lifestyle. And I try to not sit too much or move too much. I try to be varied through the day. So I try to practice what I preach.
Yeah.
And that's what I do.
Yeah, same. I mean, I practice hypopressives every day, usually first thing in the morning. I will do between 15, 20 minutes. Again, I sometimes put extra things in, but a bit like you, I just mostly stick with basic movements because like you say, you don't have to think about it. You're not trying to be creative for anyone else. I do actually run monthly groups. So in my monthly groups, I'm actually streaming live to them while I'm doing it. Yep. So sometimes I will do a session which has more progressive stuff in it.
Yep.
But on the whole, if I was to choose, I would just tend to stick with the basics myself.
Yep.
I don't do any other kind of pelvic floor stimulation at all. I don't do any pelvic floor squeezes like that. I was someone who was religious with my pelvic floor exercises when I had my really, really bad incontinence issues, and just it made them worse. I ended up hypertonic. I ended up with internal pressure point release work being done, which is not very nice. And it's just kind of put me off personally, myself, for my body. I don't really use them.
Yep.
And then I will do a structured weight session in the gym. I don't really think about bringing hypopressives into that, but often when I'm training my own clients and they know hypopressives, we will either use it as a warm-up or a cool down. So usually the most common thing I would do is take them through a training session and then use it at the end, just to kind of almost reset everything.
Yeah, I've done that.
I'm active, like you say. The rest of what I do is the same as you, with kind of healthy living and getting out there.
Yeah, I have a few clients who, if they may not be more symptomatic after resistance or some sort of weight training workout, but mentally it makes them feel better to do their hypopressives after that.
Yeah.
What I have found myself is that I get the kind of the deepest apnea, or the sensation that I love and crave, kind of the depth of that apnea, I get first thing in the morning after I've pooped, before I've eaten. So even if I was to have breakfast and let it digest and then do my resistance and then do hypopressives, I find that I don't feel it as deep or as powerfully as I do when I do it in the morning. But there are people who like to do it right after they have done their resistance from a mental health perspective, because it makes it feel like if they've done any kind of, if anything's moved or shifted, then they're kind of drawing it back up and in. So it's
just because you're not feeling it as strongly doesn't mean to say it isn't working the same.
Oh, totally. 1,000%.
Again, it's for you. It's that mental thing of that is when it feels the best time for you to do it.
Yeah.
But it doesn't, there isn't really an optimal time to do it other than don't do it. It's not like anything, don't do it directly after you've eaten, because
right.
It's very much a find your perfect time to do it and then do it then.
Yeah, the perfect time is when you do it.
Yeah, because if you're doing it, you've won the first battle.
Yeah, exactly.
That's last thing at night. It really doesn't matter, because we were, when we were trained, first of all, they were like, no, it's like it wakes up your nervous system, and so if you
I was taught that too.
If you do it last thing at night, then it's like having caffeine. It'll keep you awake. Truly, it doesn't. And usually,
totally.
I mean, there might be the odd person that it would, but usually you find that, you know, women have got small babies, they've been run ragged, they've had hardly any sleep, they do the hypopressives, they're going to sleep whatever.
Totally.
That's
totally.
not what stop them from sleeping.
And as much as it can be energizing for some, it can also be very calming. It can I find it's more almost like a with, you know, getting them away from thinking about, they're just maybe thinking about the apnea or counting or whatever they're doing. And so it can be kind of a nice way to sort of end and then get ready for sleep. So I was taught the same thing, but
yeah. I think that some of what I was first taught was much more kind of hypotheses rather than it was fact.
Right. Yeah.
And I'm sure that when you kind of teach your own hypopressives, when we teach courses, it's very much our take on it and what we've experienced and what we know to be more fact than maybe what we were taught. So what else have we got? I am a PT and got a rectoceal that I finally got referred 5 years postpartum, seeing the consultant tomorrow. Is there anything I should ask? A good question. Is surgery a good option or does it depend?
I think it always depends. I think surgery absolutely is an option. So I lived with mine symptomatically for 9 years. And I did get to a point where once so I was struggling with, I don't know how many people know my story, but I in my 40s, started to get weird symptoms, which I could now that I know about perimenopause, some of which were associated with perimenopause, but one of which was constipation out of nowhere. So I had never, ever struggled with constipation in my life. And all of a sudden was dealing with it. You know, I drank water, I ate healthfully, did all these things and couldn't understand. So long story short, I ended up having markers for like high antibodies for thyroid condition called Hashimoto's, which is an autoimmune condition, and constipation is a big thing. So once I knew that, made changes in my diet and, you know, all these things to address the antibodies and to address autoimmunity, then my bowel movements became much better. And initially it actually helped and I wasn't as symptomatic. But then what was happening is I was pooping so well and so often that if I ever didn't get that second bowel movement out, it was almost worse. Like it felt like I had this lump. This sounds terrible, I guess, but it felt like I had this bag of poop. And in my head, everybody in the world could see it because as to how strongly I felt it.
Yeah.
And I would sit down and I would be silent. I wouldn't participate. I would check out. All I was thinking about was, how can I deal with this? How am I going to live the rest of my life with this? And you know, you go through that whole thing. And so it helped initially. I got the symptoms under control, and then it just got to the point where they were actually getting worse. And then I was looking at, okay, menopause is in the future, this and this. And then that's when I finally said, that's it. I've done everything I can. And I had actually had surgery booked twice. And I knew, because I was still dealing with constipation and I was still dealing with really, really heavy bleeding. And I knew I needed to get those under control first. So if I was going to practice what I preach, I had to get those under control first. So I did everything I could and, you know, looked at hormones and diet and like everything, got those under control. And then it finally was like, it feels like the right time. And I had zero angst about it once I made the decision. The other two times I would, as the date came closer, I was getting more and more anxious because I just knew it wasn't the right time. So to answer the person's question who asked, I would absolutely go and pursue, start the process, make sure you feel comfortable with the surgeon. The questions I asked were like, I've got a whole list of questions, and it's about the type of procedure, native or at the time. So it's no longer they don't use the mesh kits anymore, but they can use other types of tissue. So is it going to be my tissue or another type of tissue? What's the recovery? What are their recommendations for restriction of movement, if any? What is their recommendations with regards to pelvic floor physio? What's the recurrence rate? What's their success rate? All those types of questions is what I was asking. And so I feel like I went into it very informed of being a pelvic health professional. I also had asked my pelvic floor physio who they would choose as a surgeon because they see the people post-op. So I had 3 surgeons to choose from. One of which is a surgeon who I actually know personally. He has a really long wait list. It was the only reason why I didn't go to him, was because his wait list was really, really long. The other one was a woman who I just personally didn't ever super gel with. And even though she was a good surgeon, I just didn't have a good rapport with. And the other fellow, I had already seen him for the heavy bleeding and all the other stuff that I was dealing with. And I just really liked him. He was a very gentle, kind, very empathetic man. And I felt fine going to him. So you need to have a comfort level with that. You need to have all your questions answered, a good understanding of the procedure. And then I had guidelines from pain medication and movement, and I followed the pain medication religiously. I highly recommend that you don't try to be a superhero and deal without pain. Like, use the pain medication that's prescribed. And I actually really like rectal suppositories for pain management for pelvic surgeries. And then also I had my own movement practice. So my doctor had said no pelvic floor exercise for at least a month. I was doing it by like very early week 2. And so that's me. I was making my own informed choice for my own body in talking with other pelvic health professionals. But I do believe it's something that can play a role. I think we should incorporate more of that into people's recovery. And I hope that doctors eventually start to advocate for that. And also, instead of just saying, don't lift anything heavy for 6 weeks and then you're fine. It's like postpartum recovery. The 6-week green light is not enough. I don't feel like that's, we deserve a lot more information. So we need guidelines with regards to what do we do in those first 6 weeks? Now, afterwards, how do we progress back to fitness? We need a gradual progressive practice.
It's rehabbing yourself back. You can't just think to yourself, well, now I've just done that event and now I'm 6 weeks later, I'm able to go back and do the running that I was doing, and I would be able to go back to doing all sorts of different things. So I
was really diligent with my, I used red light therapy. I did a lot of postpartum practices. Like, a lot of what I recommend for people for postpartum healing with regards to foods and rest and movement, I did the same things from a post-op. I think there's a lot of similarities between the two times, and saw my pelvic PT at around 7 or 8 weeks post-op, postpartum, like same thing. And then from there, it became gradual progressive loading. I didn't get the green light, like, oh, everything's healed, and then I'm going to run again, or I'm going to lift heavy again. It wasn't until like 9 to 10 months post-op that I was back to what I was lifting prior to my surgery.
Yeah. Cool. Okay. So hopefully, Siri, that answered your question. And what we know, traditional kegels aren't always the best treatment, which is why I'm looking at hypopressives to add to my treatment tool bag. I'm a pelvic floor physio. Hi, Caroline. Is there some research on the impact of hypopressives on the pelvic floor? In what respect the impact on the pelvic floor? Because there is research done, and Richard and I are in talks with a researcher at Swansea University at the moment, and we're putting together some research which we hope will be part of third year sports science students' dissertations. So we'll end up getting quite a lot of research around hypopressives, but
if I can
impact on the pelvic floor, can you be a bit more specific? Or
I'm just going to add in while you're waiting for the person to add there. It's kind of like how we both talked earlier, that we could wait for oodles and oodles of research, and maybe that would make us feel more comfortable in prescribing this to a person. But I have felt, so I reversed a stage 2 prolapse in my own body. I have worked with people who have improved stage 3, who have reversed stage 1 and 2s, who have eliminated symptoms, even if their stage hasn't changed. Like, there's so many different variables in there, but at the end of the day, I have never had anybody come to me and say, that made me worse. I hate it. Like, why did I do that? Every single person has found some beneficial change. So I'm personally, and even in my own body, there's no way in hell I was going to wait for research to support something that made me feel so much better. And it at least put me in a position of power so even before I had felt, that I had reversed, at least I felt like I was doing something that could potentially, right? I had heard anecdotally, I've heard all this other stuff. So I'm just going to try it on my own body. And I 1,000,000,000%, I would, if I was a pelvic PT, I would add this to my toolbox, no question.
100% myself as well. So yeah, Caroline just says, effects on stress urinary incontinence, improvement on prolapse. Kim, that answers my question. In your experience of teaching, most physio practice doesn't have good research, but it's done on clinical experience. I'd say exactly the same, Caroline, in that I pretty much solely teach hypopressives and in terms of symptom relief. And for me, if I've got someone in front of me that's saying to me, I can't have sex with my husband, I'm so ashamed that I leak all the time, I can't go out, I don't go out socially, I'm depressed, I can't run around with my kids, basically their well-being is under threat, and that changes for them so they can run around with their kids and they don't leak and they can have comfortable sex with their husband and they get their personal relationship back on track, then for me it's far more about that than it is about what research says. So and in my experience with hypopressives, I would say there's very few people that I actually train who, okay, if they do it like you said and then they leave it, they park it because their symptoms are better and then it comes back again, that's different. But if they're doing it as part of their daily routine consistently, that don't have positive outcomes.
Yeah. I apologize. I'm just writing. I have to run in about 5 minutes. I'm just writing a message to somebody here, but I'll have to wrap up fairly soon. Sorry.
Caroline, no problem. So it actually doesn't look like we have any more questions here. Just if anybody's there and they're thinking, oh, I really wish I'd asked a question, you do have reactions at the bottom that you can put up. So I'm just going to scan across and see whether anybody's...
And if anybody wants to ask a question they weren't comfortable asking here, you can message me. Kim@vaginacoach.com is my email. So feel free to reach out. I do share my story with my decision to have surgery and my recovery and what have you on my blog. So if you go to vaginacoach.com/blog, it's listed in there. I created a surgery support program. So if you yourself are considering it, or if you have clients who are considering surgery, I go really deep in there with regards to questions to ask surgeons, how to find surgeons, all the different types of surgeries, preparing for, recovering from. So that's there as a resource. To my knowledge, it's the only surgery recovery program that's out there at the moment. So I'm here to answer any questions if anybody has any that they haven't asked here.
Okay, well, I'm actually going to wrap it up and end the recording, but there is something I want to ask you off recording, if that's all right.
Yeah, of course.
So just hang around. So yes, thank you very much for joining us. I'm sure that we've had some really great comments here saying thank you, lots of great info. Thank you both. It's been great. Please do look at Kim's blog. And yes, I'm just going to come out that now. Oh, I didn't do it.